I'm going to be the facilitator today. I am the Policy and Advocacy Coordinator at the African American Community Service Agency, which is actually located in Santa Clara County in downtown San Jose. And I am excited to introduce our awesome speakers today, Dr. Kismet Baldwin and Barbie Robinson. I'll have them do a little introduction for themselves. We're really excited to have you all here representing Sonoma County. And so welcome to COVID-19 Black. And I'll pass it to our panelists to introduce themselves. Barbie, if you want to start.
Thanks, Helen. First of all, can we check how many folks are with us, Helen?
We have a total of 9 participants.
Great. Thank you. So thank you all for coming out tonight to talk about COVID-19 and our efforts to address COVID-19 in the Black community in Sonoma County. I'm Barbie Robinson. I'm the Director of Health Services for Sonoma County. And I'm joined today by Dr. Kismet Baldwin, who's our Deputy Public Health Officer within the Department of Health Services and our Public Health Division. And she's been working closely with the team on our COVID strategy, as well as our vaccination strategy. So with that, we have a brief presentation. We want to leave as much time as possible for dialogue and answering questions. So with that, if we could move forward with the slide presentation, that would be great. So who is eligible to be vaccinated right now? I know that there's been recent hot off the press news that beginning in April, I believe that everyone will be eligible for a vaccine. Right now, we've been focusing on, all the phase 1A eligible residents, all phase 1B eligible residents, individuals 16 to 64 at highest risk for COVID-19, individuals who reside or work in a high-risk congregate residential setting, such as incarceration, detention facility, homeless shelter, behavioral health facility, public transit and airport and commercial airlines. The data is a little outdated in terms of residents partially vaccinated, residents fully vaccinated, total doses administered. Hot off the presses for me this evening is we have about 53% of the population that's received at least one dose. So we're up to around 200 and is it 53,000, Dr. Baldwin? 253,000
Yes.
Of the 499,000 eligible residents or members of the community who have received a vaccine. Next slide. And so in terms of how do people get information about vaccine availability, we can't say it enough, and I think everyone knows it's national news that there's not enough vaccines to meet demand. However, if you go on the socoemergency.com website, it provides a list of sites where the public can register and get their vaccine. The sites include our healthcare systems, regions, address, and eligibility information. There's the link there. And you can also go to the California My Turn system as well to get information and also register to be vaccinated. Next slide. And in terms of race, ethnicity, demographics, as we know, Sonoma County has a smaller percentage of Black African American population within the county. We are at 1.6% of the population. And in terms of the proportion of vaccine recipients, we are at 1%. We are not doing as bad, we've addressed the need in a robust way with only. Having said that, I know that there are vulnerable representation, homeless population, and so work to be done in that area, and so we don't have that full robust denominator of our full population. Next slide. And so in terms of how we support vaccine efforts, Sonoma County, the Department of Health Services does not own a clinic or a hospital. So it really requires us to have strong collaborative relationships and partnerships with our healthcare partners, our healthcare systems within the county. And so we advise the state on vaccine allocation, distribution, and integrity. We recommend contract providers to support our equity plan. We coordinate provider communication and collaboration. We collaborate with stakeholders and community-based organizations to help support them in getting the word out about vaccines and helping to support our efforts to get folks in to be vaccinated. We provide vaccine center support to ensure provider success. We've stood up the mass vaccination sites to enable our partners to be able to run these, administer vaccines on a wide scale. And we provide my turn technical support, and we've implemented a communications campaign to address vaccine hesitancy and increase awareness. I think that concludes our slides. Is there another slide? I do want to turn it over to Dr. Baldwin to talk a little bit about her expertise in the science and the medicine, and to talk some about, what we've seen in terms of, the impact of COVID in the community.
Thank you, Barbie. So just like in the rest of California and across the nation, we have seen that Black or African American people who get COVID in Sonoma County are disproportionately affected. They're having more severe illness and a higher percentage of death compared to our share of the community of the county. So that has been something we're been focusing on and trying to find out a little more about that, why that's happening. I mean, we know that access to care and things like institutional racism and other social determinants of health that are in play have really set the Black community up for poorer outcomes when they actually get COVID. And we've seen that in Sonoma County, may not be to the extent that all of California or the nation has seen, but it's definitely something that we have observed. And so that's been another part of our equity focus, is really getting vaccine administered to the people who have been most impacted in our county. And the two most impacted communities in Sonoma County, I would say, there's probably three: the Latinx population, Black American population, and our Asian and an Islander group. And so that has been a main focus on all of our COVID efforts, trying to make sure that testing is available, that to anybody, and it's easily accessible. If people need any kind of income help, if they have to be isolated or quarantined, that's available to them as well. So it's not as much of an economic hardship to do what we're asking people to do, which can be quite difficult, and staying home and isolating and not going out. And you still have to pay for your rent or your mortgage. You still have to buy groceries, all of that kind of, all of those things. So helping out with that, and just trying to make things as easy as possible for people as in a very difficult time. And the same thing for our vaccine efforts. Our health equity manager and our vaccine unit has been very focused on equity and trying to get to all of those more impacted communities and trying to get them vaccinated. And as Barbie mentioned, I think we're doing a pretty good job with the Black population in the county. We've got work to do on some of our other populations like the Latinx group, but we're getting there, and we're getting people vaccinated, which we're very happy about, and trying to really do some outreach and answer questions about the vaccine, the science behind it, science behind COVID in general, the illness, and really trying to address some of the hesitancy issues that have come up as well. I'm sorry, this is my cat. So our case rates are coming down, thank goodness, and that's in all of our populations in the county. And our test positivities are also going down, which really does, I think, show that the efforts we've put in and the participation we've gotten from the community has really is paying off, because now everything's going down and we've got less transmission and less spread. We've got a lot of people getting vaccinated. So we're looking forward to continuing to progress and get anyone who wants to get vaccinated and hopefully come out of this pandemic and in the sometime in the near future. So that's I can give more medical and scientific information, but I really think it'd be nice to just have a a conversation and a discussion and answer questions and um, go from there.
So we did have somebody in the chat saying that they had a little bit of trouble hearing some of the content of the presentation from Barbie. I'm not sure what part they weren't able to hear, but I think where it cut out from you is when you were talking about some of the efforts that your county has been making to make sure that you all reached Black people. So maybe if you could go over that again, then we can move into the
How
Q&A.
about Dr. Baldwin? How about you go over it, just because I'm having some trouble with the audio?
Sure, you can do that. I just need someone to pull up the slides. I can't see it. So I think that was the last slide that you were mentioning. Yeah. So how are we in Sonoma County as a whole and Department of Health Services really supporting the vaccination efforts in the county? And as Barbie was mentioning, we don't have our own health centers and our own county hospital to be able to actually administer vaccine and actually put shots in arms for people in the county. So we've taken more of an advisory role on vaccine allocation, letting the state know which providers, which places, which vaccine centers we think should be getting more doses and where they should be going, really trying to target those communities that have been most impacted in the county to ensure that they are receiving their more than fair share of doses of vaccine so we can get those communities vaccinated. Also, again, that goes into the distribution and just really maintaining the integrity of the whole vaccine allocation process. I think the pandemic and the vaccine rollout has brought out the good in people and sometimes the not so good in people. And it's easy for people who have more means to jump the line and to find vaccine, where other groups that we really want to be targeting and have been most impacted aren't able to get in, and they could easily get shut out of the vaccine process. So we are doing all we can to make sure that doesn't happen and that doses of vaccine are getting specifically to those people so that they're not being left behind when others can easily, find vaccine appointments. We're recommending the contract providers to support our equity plan. We've got a full scale vaccine equity plan that we've developed on how to ensure that, again, this is an equitable process and that it's not just first come, first serve and who's got the means to get to a vaccine clinic and get the vaccine, but to make sure everyone has an opportunity, if they want it, they can get vaccinated. We coordinate the provider communication and collaboration. So everyone who's providing vaccine in the county, except for, we do have good communication and collaboration with our health systems, our major hospitals, but they can kind of do things on their own a little bit since they receive vaccine directly from the state, but everyone else really goes through public health. And so we make sure that there's good communication as to what we expect, who, we're targeting to get vaccinated at the time based on eligibility and, again, the Healthy Places Index and things like that, and collaborating to make sure we're getting to those groups. Again, collaborating with all the stakeholders, community-based organizations, providing vaccine center support to ensure provider access. We provide interpreters, we provide education materials, we provide, runners to help out at all these vaccine centers. We may not actually, again, be putting vaccine into people's arms, but we are supporting those vaccine centers as best we can. Again, supporting the equity framework and providing my turn and technical support. So people probably have heard a little bit about how the state of California is trying to move onto this platform called My Turn, so that with the idea of every county is on the same platform. That's how you make your appointment for vaccine. That's how the vaccine clinics are set up and established. That's how all of the data, so we know how many people have been vaccinated and who and all of that good stuff, is the same across the state. That's been a little bit of a difficult process. It's a work in progress. And so we are providing technical support to all of the vaccine providers in the county to help them get through that. Help them get through that. And then the last thing is that we're really, implementing a communications campaign to address vaccine hesitancy and increase awareness. So again, through social media, through our media briefings, through just flyers for outreach at the community-based organizations, to having Zoom meetings to answer questions and have a discussion and dialogue about this. We are trying any way we can to answer questions and address any vaccine hesitancy that people have. And that's it.
Dr. Baldwin, we do have some questions in the chat as well.
Okay.
Yes.
Right.
So did we go over the race demographics really quickly from the slide deck?
The slide. Yeah, we can. We did.
Okay, perfect. And so one of the first questions that came is, so when someone in the past has had reactions to boosters and other vaccines, do you still recommend that they get the COVID vaccine?
I would recommend you talk to your provider, your primary care provider, about that before you get this vaccine. Most of the time, if you've had a minor allergic reaction, you would be fine to get the vaccine. But in that case, I really do think it's worth talking to your provider before showing up at a clinic. However, at every clinic, we do ensure that everyone gets monitored for at least 15 to 30 minutes after receiving the vaccine, that every vaccine clinic is able to address a severe allergic reaction. They've got epinephrine. They know what to, they've got someone there who knows what to do and address that situation. But I would recommend talking to your provider before going.
The next question is, once you're fully vaccinated, what practices should we follow regarding wearing or not wearing masks?
This is a popular question. Everything remains the same right now. Everything. We want you to still wear your mask. We want you to still wash your hands and use proper hand hygiene. Please don't have a large party with a large gathering. We're not recommending that either. And mainly because, number one, in the clinical trials, they didn't really look at that. They didn't really look at, is COVID still spread after you get the vaccine? That's not what they were analyzing, or they were just seeing, okay, if you got 100 people, 50 get the vaccine and 50 got placebo or just, normal saline or something like that. And then they followed them. And did anyone develop symptoms? And if they did, they tested them and they had, COVID. Out of the people who developed symptoms, 95% got the placebo and 5% got the vaccine. And that's how they figure out how effective the vaccine is. Only 5% of the people who ended up with symptoms got the vaccine. But what they didn't look to see was whether or not, if you got vaccinated, and say I came in contact with Barbie and she had COVID, and so I'm a contact to her, and she gives, she spreads it, is it still in my nose where it, tends to live? And then even though I'm not sick because I got the vaccine, can I pass it on to somebody else? They didn't look at that. And so that's why all of the distancing and the mitigation measures are still in place, because really, as more people are getting vaccinated, that's being determined. And I think in the long run, it'll show that people who get vaccinated probably don't spread it to other people.